it's time for TIPisodes with quick tips you should know. Techniques you can implement into your workflow right here on A Tale, oh yeah, A Tale of Two Hygienists.
A Tale of Two Hygienists presents this week's TIPisode, mini episodes giving you the tips to be successful, delivered straight from the experts. This week, sponsored in part by GC America.
Hello, hello, hello. Amanda Hill here, bringing you this week's TIPisode, sponsored by GC America. Today, I want to talk to you all, my fellow hygiene friends, about getting out of your own way. Getting out of your own way? What am I talking about? Listen up. I guarantee that sometimes you get in your own way when it comes to patient care. Sometimes our inner thinking, or maybe what we, grew up with or what we've always known, sometimes gets in the way of us treating our patients the absolute best we can. And you might be thinking, what on earth are you talking about, Amanda? I got to tell you, I listened to a lecture by Sharissa Wood of Bulletproof Hygiene, and she just blew my mind. And she talked about some of the mental roadblocks that we have when we are dealing with our patients. And see if you can relate to any of these. Have you ever thought, oh my gosh, what if the patient thinks I'm too salesy, when perhaps you want to recommend a special toothpaste, like maybe MI paste for them, right? And you think, oh, they're going to think I'm trying to sell them something. Or what if they don't believe me, right? Have you ever thought that? Like, oh my goodness, I'm going to present all of this to a patient, and what if they just don't believe me? Have you ever had a patient say, oh, doc must need a new car. That must be why you're saying this, right? Another one that gets me, oh, this one really gets me, especially if it's a big case or maybe a big periodontal therapy case. This is so expensive. How on earth can I say this to a patient? What about if I give them bad news, they won't like me? I don't know about you. I'm a pleaser. I want all of my patients to absolutely adore and love me. And what if I have to give them bad news and they don't like me anymore? I know you all have experienced this thought process. What if their insurance won't cover it? Right? You have this procedure, this thing this patient would definitely benefit from, but you know their insurance doesn't cover it. What if you've been seeing this patient for a long time and now you've learned new things, right? You're listening to A Tale of Two Hygienists. You're going to continuing education class. You know more than you knew 10 years ago. And all of a sudden, you're going to tell this patient that their bleeding gums are not okay, where for the past 10 years, they've been okay. So what if you've been seeing them a long time and you've never told them this before, and now they're going to think you're making stuff up? Or what about this one? What if my doctor doesn't agree with me? Oh, that's a hard one. This one, I think we can all relate to. I don't have time to deal with this. I see these things going on in this patient's mouth. I know some science. I know some things I could recommend, but I don't have time to talk about this for this patient. And then this is the biggest one for me. What if they ask me a question and I don't know the answer? I know that I think that about a lot of new things, like think about salivary diagnostics, right? I don't know all there is to know about salivary diagnostics, so I clearly can't start it in my operatory yet, right? Because if they ask me a question, I don't know the answer. No, we don't have to know all the answers, friends. So let's talk about some ways to get out of your own way. And because I hosted the Your Dental Top 5 podcast for 2 years, I love a good top 5 list. So I have a top 5 ways of things that you can do to get out of your own way and actually put the patient in the driver's seat when it comes to their treatment. And that way, all of these doubts that you have about being salesy or about maybe not knowing enough or about their insurance not covering it, you are no longer making those decisions for the patient. The patient is now making these decisions. So my absolutely very favorite one to include the patient, to actually bring that patient into co-diagnosis. We diagnose with our doctors, right? Why on earth shouldn't we co-diagnose with our patients? And so my first one is, I actually learned this from Carrie Lepacek's dad, and he talked about the papillary bleeding index. What is that? Listen up. This thing is amazing. If at the beginning of an appointment, you sit a patient in your chair, you do your medical history, you do your blood pressure, all of those good things, oral cancer screening, absolutely. But then you hand the patient a gum pick or maybe some kind of interdental brush, right? Very tiny one. And first you show them that it's not sharp on their finger, like, look, feel this. And they're like, okay. And then you let them hold the mirror and you let them poke their gums in between, interdentally, with one of these little brushes. And you let them see where the bleeding occurs. Because all too often we are probing our patients. They're like, oh, well, my gums are only bleeding because you're poking them, right? I'm sure you've heard that. So when we do this with this little toothpick or gum pick or whatever you want to use in between their teeth and they see the bleeding, they can start to take some ownership of this bleeding because they can do this same thing when they're home and be like, okay, I'm going to keep doing this. And, my hygienist says eventually these won't bleed and they can see it happen. This is a great, simple one, very inexpensive and doesn't take a lot of time. The next one is also one of my absolute favorites, is disclosing the patient. And I don't know about you, but my memories of disclosing solution go back to hygiene school when disclosing solution was super punitive, right? If there was like a dot anywhere, I failed my patient. I got in trouble. So I hated disclosing solution. But stop thinking of it as grading you and more about helping the patient understand where they're missing. How many of us have had that patient that was like, oh, I just didn't have time to brush after lunch. But when you could use a disclosing agent like 3M's Tri-Plaque Gel, which gives you 3 colors that shows you new plaque, and then it shows you plaque that's 48 hours old. And then it shows you in very light blue, acidic plaque. And so no longer can the patient be like, oh, I didn't have time to brush after lunch. You could be like, you know what? This plaque's actually been there for a lot longer as we look at this scale. And I will tell you that what has happened with my patients in disclosing them first is when they come back 3 or 6 months later, they are like, Amanda, I'm not going to have any blue today. I've been working so hard. They really start to be able to see and understand why we're giving them all these brushing tips. Number 3, I mentioned this when I talked about what if they ask me a question and I don't know the answer, but salivary diagnostics. Our patients understand diagnostics when they go to the doctor's office. They get their cholesterol checked. They see their A1C. They see these numbers and they understand these numbers, right? And we ask our doctors about them. We want to know about them. I check them every year. I'm like, oh my goodness, is my cholesterol getting higher or lower? Salivary diagnostics are a great way to start to get some baseline to understand what is happening in our patient's mouth. What is that microbiome? Is it good? Is it maybe virulent? Is it headed down a path we don't want? And then if we have one of those patients that we think we're doing all the right things and we're just not seeing the results, we can actually be able to see some changes that happen if you were to do these annually, perhaps, to see the changes in our patient's mouth. Don't feel like you have to be a complete salivary diagnostic expert to start salivary diagnostics. I want to encourage you to just start, and you can learn along the way. All of the different companies will offer some kind of training, and you can reach out to all of them, and they will help you be able to learn and start to decipher what all these microbes that, you kind of remember the names of from hygiene school, but you don't really know what they mean, but they'll help you along the way. And as you get better at this, oh my gosh, your patients are going to start to look at you like a healthcare provider. All right, number 3 is using your intraoral camera or your scanner or both if you have them. Showing patients what's going on in their mouth and showing them changes from visit to visit is huge for helping them become the owner of their problem. All too often, we're the ones owning patients' problems and they still don't understand what's happening. And so being able to get in there and show them exactly where that calculus is or what that cracked filling looks like. I know that that's not new information, but when we sit them up and we actually let them look at the pictures and we can even print them out, or they can take a picture with their phone so they can show their loved one when they get home and be like, yeah, look at this cracked filling. This is why I have to get it done. They're more likely to come back. And lastly, I have not been able to experience this, and maybe some of you have, and please reach out to me, but AI. Oh my goodness, some of these AI programs that are coming on board that will help you look at x-rays and look at bone loss and decay and all those kind of things are amazing. And our scanners actually have some built-in AI too, which will show us recession and it will show us where we can kind of be like, well, I think that hasn't worn in a year. Do we really know? Bringing in these programs that actually give us that third party really show patients like, look, this is what our program is showing us, and this is what we're seeing. And then it's not even you, it's a program that's helping you understand this. So these are 5 tips for being able to get out of your own way, to stop doubting yourself, to stop deciding for the patient before you even bring up this great treatment that you have recommended for them, to be able to help them come in and be engaged in their treatment. So papillary bleeding index, disclose first, salivary diagnostics, using your cameras or scanners, and then if you can, check out some AI. And if you're able to play with it, oh my goodness, tell me all about it, because I really haven't gotten to yet. So that's this week's TIPisode, everyone. I hope you enjoyed it. I hope you can take something back into the op that will help you feel a little more confident when talking to your patients and allow your patients to take ownership of their condition. Have a great day, everyone.
A tale of two hygienists.